Hello and welcome to the 2019 Open Enrollment presentation for Thank You Nurses. Over the next 15 to 20 minutes, we're going to be going through all of the different insurance products that are offered through Thank You Nurses that are listed here at the top. Before we do, we're going to walk through a couple rules of the road. So right here in the middle of this page, you'll see that we have listed out who is eligible at what point in time. And then at the bottom of this page, you'll find reasons where you can change your election or what you choose during the middle of the year. In general, what you pick sticks for 1 year unless you have one of these qualified IRS life events. We'll spend most of our time talking about the medical pricing. Before we get into the schedule of benefits themselves, you'll notice in your enrollment guide that rates are broken out a couple of different ways. The first way they're broken out is by pay range that are listed here on these pages that I'm highlighting. And then the second way that you'll notice that rates are broken out are different metallic tiers. Now you get a better rate from Humana, which is the insurance carrier for next year, if you participate in their wellness program called Go365. We're going to be talking a little bit about that, but your rates go down as you reach different levels. So for example, if you made between $8.15 and $8.99 and you did nothing, then your semi-monthly cost is $52. If you hit silver status, it's $39.89. If you hit gold or platinum status, it goes down to $26.04. And so you'll see this sliding scale of price reduction as you achieve higher status levels within the Go365 platform. It's a fantastic wellness opportunity. It is not just for marathoners and CrossFitters, it's for regular folks like you and me. We just want to make sure that we're recording via a step tracker on your phone or a Fitbit or something like that, how much you move throughout the day so that you get some points for it. And there's a little more to that as well that I'll talk about before we leave you today. Let's talk about the benefits themselves. We have 4 different options. We have an HSA option that is Plan A. It is the least expensive. The maximum amount of individual exposure is right here, $6,350 on an annual basis. Your deductible is $4,500 listed here. So when you go into a hospital, you're first expected to meet your deductible, and then insurance starts to pay. After you meet your deductible, you're paying 30 cents on the dollar. And after you pay 30 cents on the dollar of those bills that come in after the deductible, then your total out-of-pocket maximum is $6,350. So that's your worst-case scenario. So $6,350 minus $4,500 is $1,850. So in other words, if I have a $20,000 bill, I'm first paying $4,500. So $20,000 bill minus $4,500 is a bill of $15,500. However, I'm only paying 30% of that bill, or $4,650 of coinsurance. That $4,650 plus the $4,500 that I paid in my deductible equals $9,150. But I'm capped at $6,350. So this is the worst case scenario. You meet your deductible first. After your deductible, you're sharing costs with the insurance carrier. So I want you to think about these plans in 3 different ways: hospitals, doctors, and prescriptions. When you go into a hospital, you have to first satisfy your deductible. But if you're on some of these other plans, for example, Plan B, when you go to the doctor, you're paying a copay, $40 for primary care, $65 for a specialist. And on Plan B, when you go get a prescription, you're on a copay. Whereas on the HSA plan, if that doctor visit actually costs $150, they'll give you roughly a 50% network discount for using a Humana doctor, and you'll have a $75 bill. You'd be paying $75 for the doctor here, but you'd be paying a copay over here. So for the right to pay copays when you actually use care, the premium for that coverage is a little more. So it really depends on utilization. Plan C and Plan D are the most expensive because their copays are the least amount. Their out-of-pocket maximum on Plan D is the least amount of any of the 4 plans. The out-of-pocket maximum on Plan C is similar to some of the other out-of-pocket maximums that you see on the other plans. So it's really just a function of utilization throughout the year. Do you want a lower copay for when you actually use care for a prescription or for a doctor, knowing that when you go into a hospital, you're going to have to meet your deductible and your out-of-pocket maximum on 3 of the 4 plans is largely the same. So make your decision based upon how much you anticipate actually using the plan throughout the balance of the year. If you're on the HSA plan, you have an opportunity to contribute additional money out of your own paycheck into an account that is a bank account in your name. It's tax-free dollars. If you leave employment with thank you nurses, you take that money with you. The other 3 copay plans do not have a HSA bank account attached to them. Because of what you guys do for a living, you're going to know this pretty intuitively, but we always like to mention, please stay away from freestanding emergency rooms whenever possible. Urgent care is a great way to get the job done. In addition, I love this feature, Doctor on Demand, 24/7, 365. The first time I did this, it took me 17 minutes. I've got 3 kids, and my 3rd kid had 2 red eyes. And so because we watch a lot of doctors' videos at night, and doctor movies, my wife and I feel like we are clinicians almost. And so it looked like my 3rd kiddo had 2 red eyes, which looked exactly like pink eye. So we called the doctor and said, is this pink eye? The doctor actually said, yes, it is. Sent a prescription. It cost me a copay. Now, you'll remember that a copay is a discounted rate when you actually access care. But if you're on the HSA plan, you're paying the actual doctor's discounted rate, not a copay, except when you use Doctor on Demand. The Doctor on Demand is $49 if you're on the HSA plan, so you actually do get a copay just for that feature. Please register for the Humana app if you haven't. Both Humana.com, you can register yourself either online, but also download their app. It'll have your ID card, in-network doctors, stuff like that. Also download the Go365 app. This is a big app to download. This is how you're going to start tracking your activity so that you get rewarded by cheaper insurance costs when you are active. We're around throughout the year to help with this. We do so pretty regularly, but think about it like this. You get 2 things from participating in Go365. Number 1, you get cheaper insurance premiums. Number 2, you get Humana bucks to spend at Amazon, Target, iTunes, places like that, Under Armour. There's a whole online mall. So not only do you get cheaper insurance premiums, you also get Humana bucks that you can spend on real live stuff. So I bought a bunch of iTunes, like $100 worth of iTunes, and it was free to me, so to speak, because I had used my Go365 Humana bucks to be able to purchase them. So you get points for education, for a health assessment, or for fitness, running around, completing steps every day, for prevention, like dental or vision exams, flu shots, nicotine tests for healthy living, donated blood. There's all these different ways which we'll be communicating more information, because we really want to see you hit either silver or gold or platinum status so that you can earn rewards and get more out of your insurance. Here's a listing on page 12 of how many points it takes to get to each level. So if you have 1 person on the plan, you've got to hit 5,000 points to get to silver, 8,000 to get to gold, 10,000 to get to platinum. If you've got more than 1 person on the plan, then the points are higher. Let's talk about your teeth. Humana is the dental carrier. The rates are below. Here's how dental works. When you go in to get a preventative service, when it says 0% deductible waived, that means it's $0 to you. But let's say that they find a cavity, which would be something like a basic service. Here's how that works. You go in, the cost for the consult and the 2 times per year cleanings are covered by the cost that's already coming out of your premium. It's coming out of your paycheck, right? But let's say the cavity costs $200. 200 minus 50, you got to meet your deductible, equals $150. That $150 is paid for by you, 20% of it. So 20% of 150 is $30. So you've met your deductible for the year. 80% is paid for by the insurance carrier, or $120 of that $150 balance. And that $120 that they just paid posts against this $1,000 annual max. Now, if you have 3 kids and a wife on the plan, then each person gets $1,000. If you've got braces that you need, so I've got a couple of kids, and as they're smiling at me, I'm going, oh no, we are going to have to buy some braces. No insurance policy, no dental policy is going to cover all braces. Many don't cover any. So just as an example, you could put extra money aside into your HSA account if you were on that plan, tax-free, to be able to pay for out-of-pocket expenses on dental. That's the point. I just use braces as an example because that can be very real to a lot of people. You can find an in-network dentist through the app or online. Humana is also the vision insurance carrier. And the cool thing about having Humana for dental and vision, when you go get your preventative services for dental or your preventative service for vision, Humana automatically gives you Go 365 points that help build those points towards getting silver or gold status. The thing that confuses people the most on vision is where it says once every. That means you can't get glasses and contacts paid for by the insurance carrier at the same time. You pick to pay for one, the insurance carrier pays for the other. My wife has actually found some good resources through Zenni Optical and Warby Parker, lenses and glasses for pretty economical prices. Went to Walmart one time and we paid like twice the amount that she could find online. So there's some good resources out there to buy some good glasses and lenses. So this is life insurance. It's only $1.95. It's $15,000. Make sure that when you sign up, you choose your beneficiary. That's where the football goes, so to speak, if you're not holding it anymore. It can be anybody you want. You can split that up between several children, or you can give it to the child with the most promise and then not give anything to the other two. Might not want to tell them that, but I guess they would find out eventually. Employee Assistance Program, what I like most about this, it's free to you. We've got more information on it. Some folks use it for online will prep. So that's what I like most about it. If you have any questions about that, contact our office and we'll hook you up with the Employee Assistance Program so they can prep your will for you. Premium only plan simply means that these deductions come out before taxes do, which is hopefully the way that we want it. Here's some more information actually on the EAP, what is included in it, and what you get is on 17 and 18, and we've got the number here. So we've got a host of other plans, and I want you to think about them like this. When we think of medical, dental, vision, when we write checks, medical is largely going to hospitals, doctors, or prescriptions. Dental is going to the dentist. Vision is going to the eye doctor, right? So voluntary supplemental benefit plans, when something happens, the check goes to you. So for example, there's an individual disability product offered. Disability is insurance on your paycheck. That means if you get sick or hurt, can't come back to work, then the insurance carrier makes an assessment of the severity and the duration or length of the injury and cuts you a check for it. If you're in an accident, you can get a bigger paycheck if you break your leg in 2 places than if you just broke your leg in 1. There's a cancer policy. A medical bridge policy is for somebody who would be on one of the really high deductible plans, but was concerned about meeting their deductible. So if you buy the medical bridge plan, you're paying a less expensive rate for the medical bridge plan. If you go into the hospital and are there over 1 day, Colonial sends you money, and however much money they send you, depending on what you go in for and how long you're there, you can use that money to pay down your deductible, or you can use it for gas and groceries. Critical illness is heart attack and stroke focused, so there are some policies in there for folks who are concerned with that. Term life is life insurance for a defined period of time, like 10 years or 20 years. Whole life is for your entire life, and the premium is more for that. So I just overviewed all of these policies. Here's short-term disability insurance on page 20 and 21. The accident insurance is on page 22. You'll start to see what you can get. Nobody would want to use the loss or loss of a finger or toe, but you get $1,200 out of it. And I will say I got some huge watermelon-sized pumpkins over Thanksgiving from Costco, and I was cutting through them with a knife, and I thought, I have a policy like this, and I was thinking, gosh, if I accidentally hurt myself, at least I get a check out of it. So I liked that, but thank goodness I didn't, so I didn't have to trigger the policy. Here's cancer insurance. There are actually two different kinds. Level 2 benefits are a little skinnier. Level 3 benefits are a little fatter. So you'll be able to look at those. Hospital confinement indemnity insurance, bunch of words. That's that medical bridge plan. That's the one if somebody's concerned about how high their deductible is, then this may be a good buy to be able to pay for the deductible if you go into the hospital. Critical illness covers these kinds of illnesses. So if that is of concern for you, then you'll be paying attention to page 31. Term life is for a specified period of time on page 32 and 33. Whole life is for your entire life, and that's on page 34 and on page 35. Now here are all the different prices for everything that we just went over. It's broken out by how old or young you are and what the benefit amount is. Now, one of the most confusing things is actually having somebody walk you through this. So I want to direct you, if you have a question on Colonial, these are all required notices that we won't cover in today's presentation. But if you have any questions at the end of the guide on page 47, Jenny Jinks is in our office. She's bored all day and doesn't have anything to do besides answer questions and deal with provider issues. And so we know this stuff can be sometimes a little boring and sometimes a little confusing and a lot of times pretty frustrating. So please utilize us throughout the year. If you have a question on anything that we presented, even if it's us taking a look at a bill that you were sent and you don't understand it, or if you have a question on any of the Colonial Life products, then their number is here. You can also reach out to Jenny for a dedicated point of contact within Colonial. Her name's Kelly. She's fabulous. So Jenny can make a connection for you there as well. But any question or concern you have throughout the year, please reach out to us so that we can help. It beats you sitting on the line with Humana for an hour. We'd like to do that for you. So just remember that we're here for you throughout the year. Little dictionary definition just to fill out the rest of the booklet, and then the rest of the information is just notes pages, so you can scribble down thoughts that come to you throughout the year, and some happy people running with a dog at the end. My name's Ben Hallback, and I work for Catto&Catto. We're insurance brokers and nerds, and part of our job throughout the year is to make sure that you guys and gals get the best deal in the marketplace, and we're satisfied and happy to be able to be working with the team at Thank You Nurses. And on behalf of that team, thank you for your time and have a great day.